evening, everyone. I'm Collietta Bassett. I will be reviewing the Stakeholder Education Plan for my clinical scholarly project. The purpose of this project is to implement an intensive outpatient mental health program in Mendenhall, Mississippi. The program will be open to all mental health patients ages 18 and over, but the target population is individuals 55 years of age and older with multiple mental health hospital admissions. The goal is to decrease hospital readmissions over a period of 3 months for geropsychiatric patients in this rural town. The key stakeholders that have been identified in regards to the implementation of this project are the owners and administrative personnel of Simpson General Hospital, the Community Board of Directors, which consists of influential personnel in the community. The board consists of 10 members and includes 2 lawyers, 3 business owners, a dentist, former sheriff, bank president, PhD holder, and a school official. Also, physicians and providers, the payers, such as the insurance company, employees, patients, families, and the community. The owners and the Community Board of Directors for Simpson General Hospital is the main group of individuals that are needed to approve a new program. The program idea, first drafted by me, is then discussed with the CEO and administrative personnel. If the program appears viable, it is then passed to the Community Board of Directors for approval, and once approved, the owners still have the final say-so. The program requires a psychiatrist or psychiatric nurse practitioner to operate. It will be important to have the backing of the provider to ensure a smooth running program that will meet the established goals. The program will be heavily funded through Medicare reimbursement. Medicare guidelines must be reviewed and followed accordingly to ensure payment. For the program to operate, there must be participants. Patients must see the benefit of the program and be satisfied with the program to ensure completion and meeting the individualized care plan goals. This program has a requirement that program participants have good family resources to ensure their safety while continuing to stay out in the community during treatment. Therefore, the families are key stakeholders as well. The community role as stakeholder is the community will be one of the largest referral bases for the program. I also consider the hospital employees as key stakeholders. The employees need to be included in the implementation of the new programs. As a transformational leader, I'm aware that I need to motivate employees and ensure they see the benefits of the program because they will be the individuals actually carrying out the daily activities of the program. The program will not run effectively if the program is not valued by the employees. Each group, not including the payer, would need to be educated on the intent and purpose of the outpatient program. Each group would need to be informed on the benefits of the program and not just the financial benefits because all the stakeholders do not have a financial interest in the program. The development of intensive outpatient program for geriatric psychiatric patients in Mendenhall, Mississippi has several benefits. The program will be beneficial to the underserved population in the area, allowing them to get treatment close to home. The program will be beneficial to the community as a way of controlling negative issues that arise from patients in the community not receiving mental health services. The program will benefit current patients, offering them services that will keep them from frequent hospitalizations. Lastly, the program has the possibility of being beneficial as providing a solution to the current problem of a high readmission rate on the geriatric psychiatric unit at the hospital. The community board, providers, administrative personnel, employees, patients, and families would need to be educated on the criteria for admission for the patients, the services offered, and the days and times of the program. All staff who will have direct contact with the patients will need a managing aggressive behavior training course, which is already currently required, and will need to be informed on ethical implications, which I will discuss later. The community board and administrative personnel will also need to be educated on the possible risk of implementing this program. The payer will need to be educated on the type of program implementation to ensure reimbursement. During my current semester, I read a book on systems thinking and learning. In this book, Stephen Haynes made the relationship between theory and authentic practice. He states that looking at the theoretical background of a problem could serve as a theoretical framework for understanding the problem and implementing change. Having a relatable theoretical model is the foundation of my project. The title model is a mid-range theory of nursing with the focus of helping individuals realize their problems of human living. It revolves around the person making their own account of the problem they are dealing with and the discovery of what mental health means to them. In the title model, the individual is represented theoretically by three personal domains: self, world, and others. Self is the person's experiences, thoughts, feelings, beliefs, and values. This is thought to be the first place where a person experiences mental illness. World domain is where the person shares parts of the self domain with others, relating their personal thoughts and feelings, and the focus is the understanding that the person and the person's problems of living. The other domain is where the person carries out daily activities with others. This aspect includes work, family, and engaging in different interpersonal and social encounters. As mentioned earlier, the goal of implementing the outpatient program is to reduce rehospitalizations. The title model is perfect for my project because it takes into account the thoughts and feelings that mental health patients undergo. The model relates well with older adults as it builds off the premises of giving the gift of time, revealing personal wisdom and understanding that change is constant. It is an appropriate model for the patients who are more stable and not in acute crisis, and the principles of the title model can be built directly into the functioning of the outpatient program. And it gives the patients the opportunity to focus on the tools they need to maintain stable mental health. It is my thought in implementing this program that patients who frequently find themselves in acute crisis and often hospitalized can have an alternative where they are receiving ongoing outpatient services that will hopefully keep them from getting into a crisis and being rehospitalized. The program not only utilizes idle time but allows patients to socialize with others, have needed individual and group therapies, and consistent medication management. Most sources reveal that patients are rehospitalized because they stop taking their medications, they have poor aftercare services, lack of transportation to get to aftercare appointments, and the belief that the issue will resolve itself. The outpatient program is designed to combat these issues through the array of services that are offered. Linking the program with the teachings of the tidal wave model also helps to set up an understanding for the patients of their mental illness and that the condition will not resolve itself. Simpson General Hospital is currently phasing out a program which will make room for the intensified outpatient mental health program. The hospital is anticipating a start time within 1 year. Admission requirements / criteria for the program is patients must be at least 18 years of age to participate. Patients must be experiencing acute symptoms of mental illness and not be in a crisis. Patient must have family and or community resources necessary to support safe living in the community during program participation. Patients must have high recidivism rate for inpatient psychiatric treatment. Patient must be able to benefit from a coordinated program but not require 24-hour care. The patient must be willing and able to participate in an intensive daily group program. The patient must have been identified by a diagnostic assessment as having a need for intensive outpatient mental health services. The patient must have a plan of care and be under the care of a physician who certifies that the need of services for a minimum of 20 hours per week. The maximum amount of patients that will be serviced will be 30. Services that will be offered through the outpatient program are psychopharmacology, psychotherapy, recreation therapy, nursing education, and individualized treatment plans. The treatment program will consist of individual, family, and group sessions. Patients will be provided transportation to and from the facility in vans provided by Simpson General Hospital. Patients will be provided a continental breakfast and or snack and full lunch. Patients will also be provided with education regarding available community sources. The facility will be open Monday through Friday from 8 a.m. to 4:30 p.m. Patient hours at the facility are 9 a.m. to 2 p.m. Monday through Friday. Required staffing for every 12 patients is 1 psychiatrist or psychiatric nurse practitioner, 1 licensed master level therapist, 1 registered nurse, 1 recreational specialist certified, a full-time staff or consultant for full-time activity therapist, and 1 mental health technician. The main line of support for the implementation of this project is Simpson General Hospital. The hospital is a big supporter of this project and looking forward to it being implemented. The hospital currently runs 2 partial hospitalization programs and is in the process of combining the programs. Therefore, this project comes at the perfect time. With the closing of one of the partialized hospitalization programs, a lot of essentials will be readily available, such as the building, staff, and equipment. Training will be minimal, and the two programs will be very similar in nature. Marketing for the program will be handled by the current hospital marketing representative. The hospital employs a consultant company that drafts its policies and procedures and conducts training. A cost analysis was drafted for the implementation of the program. The analysis showed potential savings of $13,018 a week, which is roughly $676,000 yearly. Risk associated with the implementation of an outpatient mental health program in Mendenhall, Mississippi appear to be low at this time. With support and resources readily available at the hospital, their associated risk is low. As with any business, the worry is the risk of losing money. Funds for the services that will be provided are mostly reimbursable through Medicare. Ethical issues to be aware of when dealing with geropsychiatric patients is ensuring consent is informed consent. Also, in regards to consent, one needs to be sure that the patient has the mental capacity to give consent. Even though Mendenhall is a small town, confidentiality of patient information still needs to be maintained. In maintaining confidentiality, however, practitioners need to remain cognizant of duty to warn clause with psychiatric patients to ensure safety of the patient and others from harm. Evaluation method can be through the use of patient satisfaction survey. The sign of success for the program that I am going to be looking for is in the numbers. I am hoping to see a definite decrease in the number of hospital readmissions, the census of the hospital staying near its maximum, and the program being profitable for the hospital. I would like to thank you all for listening to my presentation and hope it has been enjoyable as well as informative.